let's quickly review the preparative studies we need to do before a patient going into cardiac surgery. So this is after taking the complete history and physical examination of the patient. We are going to need laboratory studies and imaging studies. So laboratory studies, this is going to be complete blood cell count. This is to evaluate for anemia, so evaluate red blood cell, evaluate for any possible infection, so leukocyte count and platelets. This is because of the risk of bleeding during or after cardiac surgery, and also because of one of the complications of heparin, which is heparin-induced thrombocytopenia. Because remember that heparin, we use it before the patient going into the bypass or the machine we use for cardiac surgery. Only patient needs to be on heparin before undergoing cardiac surgery. So platelet count, basic metabolic panel, which will include electrolytes, sodium, potassium, chloride, bicarbonate, glucose. If the patient has diabetes, we will ask for glycosylated hemoglobin. BNP, this is to evaluate for possible heart failure, brain natriuretic peptide. Also blood, urea, nitrogen, urinalysis. This is to evaluate for urinary tract infection. Liver function test, this is because most of the patients have coronary artery disease and they will be taking statins. So one of the adverse effects of statins is damage to the liver. So we want to have a baseline liver function test. If the patient is going to be on amiodarone, because for example developing atrial fibrillation, we need to have a baseline TSH, because amiodarone can induce hypo or hyperthyroidism. Also, we will ask for coagulation studies. So we want to know the INR if the patient is taking warfarin, prothrombin time, partial thromboplastin time, and we measure the activated coagulation time, and we measure this before the patient going into bypass. Before the cardiac surgery, we should be greater than 400, and this is a measure of in seconds how quickly the patient can produce a clot. But at high levels of heparin, the PTT is no longer works. So we use the activated coagulation time. We will discuss this in more detail later on. We also need to evaluate for pregnancy. So human chorionic gonadotropin hormone, and we need to evaluate if the patient has sickle cell disease, because this increases the risk of developing clots during or after cardiothoracic surgery. So this is the laboratory studies we ask before patients going to surgery, and imaging studies. This will be an EKG. This is to evaluate for cardiac rhythm and ischemia. Chest X-ray. This is a posterior anterior view and a lateral view. Most of the time we also do an echocardiogram, and this is to evaluate for wall motion. valves, aortic calcification, pericardial thickness, and fluid. We can ask for catheterization. This is, for example, in a patient undergoing coronary artery bypass grafting. We will ask for a coronary catheterization, but there are few contraindications to this. Contraindication to catheterization, which would be if the patient has severe aortic stenosis, or if the patient has vegetation in the valves, in the left valves. This is because of the risk while doing the catheterization, we can unplug some of the vegetation, and this can embolize to the brain or other places. So severe aortic stenosis and vegetation in the left heart, this is contraindication to catheterization. Sometimes we can also do a CT scan. This is for evaluating a mass in the thorax and to evaluate for the aorta. So preparative studies, we do a complete blood cell count, so red blood cells, leukocytes, and platelets. We also want to cross-match patient's blood. This is, we want to have 2 packs of red blood cell before surgery in case of the patient going into a operation of cardiothoracic surgery. We will have 4 packs of red blood cell and fresh frozen plasma in reserve. So complete blood cell count, base metabolic panel, which is electrolytes, glucose, blood urea, nitrogen, creatinine, glycosylated hemoglobin in case of diabetes, urinalysis, LFTs, TSH, coagulation studies, prothrombin time, partial thromboplastin time, activated coagulation time, and INR in the case of warfarin use. We need to evaluate if the patient is pregnant, if the patient has sickle cell disease or sickle cell trait. Imaging studies, this is EKG, chest x-ray, this is what we always ask, and several times we ask for an echocardiogram before, or at least also the echocardiogram is going to be done during the surgery. Catheterization, which have contraindications during severe aortic stenosis and vegetations in the left heart valves. And to evaluate for the aorta or thoracic mass, we can ask for a CT.